Signs and symptoms of a blood clot. The first step in diagnosing blood clots in the arms and legs, called deep vein thrombosis or DVT, and blood clots in the lungs, called pulmonary embolism or PE, is to recognize their signs and symptoms. Blood clots can be fatal, yet they can also be safely treated, so it's important to recognize warning signs and act quickly. Let's start with the signs and symptoms of a DVT specifically. These signs and symptoms usually occur in the leg, but can also appear in the arm. They include, but are not limited to, swelling, pain or tenderness not caused by an injury, skin that is warm to touch, redness of the skin. Contact your doctor as soon as possible if you experience any of these symptoms. Signs that a DVT has progressed to a pulmonary embolism or blood clot in your lung include, but are not limited to, difficulty breathing, chest pain that worsens with a deep breath, coughing up blood, faster than normal or irregular heartbeat. You should seek immediate medical attention if you experience any of these signs, as they may be life-threatening. If you cannot immediately reach your doctor, you should go to an emergency room. Once you notify your doctor about your symptoms, he or she will go over your medical history, perform an exam, and review both your medications and risk factors. You may then undergo some diagnostic testing. Depending on your risk factors and symptoms, the doctor may perform a blood test or imaging study or both. You may have a D-dimer blood test that measures a substance the body creates to dissolve blood clots. If the test shows high levels, you may need further tests to see if you have a clot. If the D-dimer level is normal, you may not require an imaging study. A common test for diagnosing a DVT is an ultrasound that uses sound waves to create images of blood flowing through the blood vessels in the affected arm or leg. If your physician suspects a blood clot in your lung, he or she may order more tests, including imaging studies. A thorough evaluation will help diagnose whether or not you have a blood clot and the best approach to treating it.